and it'll give you a preview over here in a minute. Zoom live.
Are we live? Think we're live.
We should be live.
Can people hear me?
There we go.
I'm over here just vibing, and I think we were testing something out. Hi. Hello.
It should be working. Okay.
We're 1 month in to our new setup, and it changes a little bit every single time because we're still playing around and testing things, but super excited. Thank you, Alex. Super excited about what we're doing. So I actually had a whole thing about, first of all, is there anybody out there? Can you hear me? Please say hello. I've been listening to a lot of Frozen lately. I had a couple ideas I want to talk about for live chat. Not for live chat, but for the Medicare Cafe pre-chat. However, I just finished up reading this article by our partners at Deft Research, and I have to address it because it's just more and more of what we've been talking about. But before we get started, welcome to the Medicare Cafe. We are currently in our pre-chat segment of the cafe, which is basically we talk about whatever we want to talk about. But if you want to have questions, let me know. This is my actual phone number. Text me. Even if you're watching the recorded version of this, feel free to text me. I try to answer within 24 hours, and I just love your interaction. I've met a lot of my wonderful friends who I talk to on a daily basis now from texting me on the show. So please do. You are joined today by your host. As always, my name's Olivia Richardson.
And I'm Sadie Palmer. I'm here. I promise. I'm just double checking the live stream because I'm a crazy person.
No, Sadie's actually usually behind the scenes. She is the producer of Medicare Cafe. Every once in a while, I butter her up and sweeten her up and ask her to be on the show. And today is a lucky day where she's actually volunteered to be in front of us, which I'm very excited for. So in the couple minutes that we have left before 10 o'clock when the show actually starts today, what I wanted to talk about initially was what are some things that you are willing to pay stupid money for? And I want to get to that maybe at the end if we have time, because I think people's answers of yeah, I'm going to cheap out on food, sometimes medicine, sometimes that, but I will spend all of my money on insert random item here. And I think it's really telling and just fun to have that. But before we do, I just read an article on LinkedIn, the Facebook's older cousin, and our partners over at Deft Research just released this article from their findings. Deft Research is the #1 organization that researches buying behaviors, especially related towards their health, of the Medicare population. They're starting to do more with the ACA side, but they are by far the best out there at finding the research about what is going to be what's affecting purchasing decisions of today's senior. Mm-hmm. They just published 1 hour ago, George Dipple, who is the president of Def Research, just published this article just a little bit ago with their findings, and the too long didn't read version of it is that the seniors were able to rate their satisfaction. Particularly, they're studying more how Medicare Advantage plans and Medicare supplements, which way is the consumer going to go? And in this article, he's mentioning that in 2024, they asked consumers on a scale of 1 to 100, rate how satisfied you are with your Medicare Advantage plan. In 2025, this time around in 2025 versus this time around 2024, Medicare Advantage plans on average dropped 10 points of people being satisfied with them, which is a significant drop. 10 points is significant. Now, there were other things and other factors that affected it, but it was basically saying hey, we saw another massive year of MedSup to Medicare Advantage switched. People are not happy with their coverage. Now, we know that, again, Medicare Advantage plans had to take a step back last year. Mm-hmm. Not all of them. United Healthcare took a step up in a lot of cases, but we do know spending, where have you been since, April of last year when we started talking about the industry. Yeah. But what was interesting is that they also noted here that according to a healthcare consulting firm, only about 10 to 20% of the senior population have enough savings to even afford a Medicare supplement. So his point is, if they don't like Medicare Advantage plan, where else are they going to go? They the MedSup for a lot of these consumers, we've been talking about this, Medicare supplements are becoming a luxury product, reserved for those individuals who have the income for it, and it didn't used to be that way. So they're saying even though the satisfaction rate with Medicare Advantage plans dropping 10 points, Medicare supplement isn't an option
Right.
for
most people.
90%, 80 to 90% of those individuals.
Right.
So they're just talking about how that means that the loyalty rate, like since they can't switch products, you're going to see a lot more shopping. So OEP, still a ton of shopping going to be happening right now. And then 2026 AEP, we don't have the time to talk about it today, but 2026 AEP is going to be another one for the books of just like crazy.
I know that you said that the research was from year to year.
Mm-hmm.
Maybe you already said this,
I didn't.
but what time of year are they asking people?
Yes,
this?
let's see.
Because I would assume that might,
yeah,
make a difference.
Yeah, they usually it's probably like if it's this time they're doing it from like January to today. If they're looking at 2025 data, then they're looking at January from today. But I will do a little bit more reading on this and actually looking at the report. Again, if you don't follow George Dipple from Depth Research on LinkedIn, you should. He posts this stuff all the time. I was just reading it while I was waiting for me to learn how technology works. Really, really fascinating stuff. Definitely give them a follow if you're not.
Yeah, most definitely. That's where we get like a lot of we rely pretty heavily on Deft Research.
100%.
Just to, I guess like all the industry people do just because that's where we can get it specific to that. But yeah, if you're not following anything with Deft Research, that's where we get a lot of our statistics.
Mm-hmm.
Yeah, for sure.
It's just like, it's just like, if you sell to the senior population, but you're not interested in learning how the senior population is wanting to buy,
right?
Then what are you doing?
Well,
then where are you at?
I was just thinking about this earlier this morning about how like we are so obsessed with generations and putting each other like in and it's not a good or bad thing. I think it can be, but it's like because there is such a stark difference between generation to generation.
Yes.
That's why we're obsessed with it. And so it only makes sense for you to study specifically this one rather than like,
oh, I'm obsessed.
Like how we would shop or something like that, because it's just going to be
very different.
Very, very different.
I'm obsessed with like, why do millennials have so much trauma? And it's like, oh, we don't even have the time to talk about this. But like every generation had trauma, but millennials are like the first to really be like, no.
Millennials acknowledge it.
We acknowledge it. And then the Gen Z's like leans into it.
Yeah.
It's just so entertaining. We don't have time for that today. Welcome, my friends, families, neighbors, dogs, and I don't know who else. Today we're at Medicare Cafe. It is February 4th, which is exciting. The groundhog did see its shadow, which I thought it did every year, but I guess last year the groundhog didn't see its shadow.
I feel like it has always seen its shadow. I feel like there's very few times in my life where I've felt like it's been like, oh, like whatever. So now we're going to have an early spring.
I would love to know, how did that tradition start? I bet that'd be fascinating.
I looked it up yesterday.
Still?
Do we have time? Well, basically it started.
Do we have time? Don't care.
Long story short, it is something that's like kind of an ancient tradition in using animals in general to, if they see their shadow, then they're like, cool. Like some traditions, it's been badgers. Some it's been bears, like all that sorts of stuff. And so basically that tradition got brought over to America and they decided to use a groundhog for hours. Yes.
We're wild.
I know.
This is what you can expect to hear from us today. More groundhog talk. I also want to know like what you are going to spend your money on. However, the stuff that you actually care about today, tech talk. What apps do you need to make sure that you have on your phone or whatever mobile device you have? Tip of the week. What data are you tracking and how are you using it? And then the question of the week, how much should I pay for that book of business I'm looking to buy? I've gotten really good with my left hand on this little keypad.
I know.
All right, let's talk about it first. Tech talk. These are some apps, and now some of them can be covered like multiple things and covered in one app. These are some things that you should download to make sure your life is a little bit easier. Number one is the expense and mileage tracking. When you own your own business, write everything off. Like there's 90% of what you spend your money on can be write-offable. That's not true numbers. I failed accounting. I want to be very clear. I don't know how taxes work, but understanding that like driving to appointments, driving to trainings, driving to the store to get supplies for your company. A lot of that stuff is considered mileage, can be wrote off. However, if you ever get audited, which, a lot of small businesses will not, but if you do, you need to make sure that everything is tracked, everything, you have a receipt for everything, and things can get really overwhelming because, like, your primary focus is to get new clients, write more business. The paperwork is what I'm terrible at. My expense reports, I'll do 9 months later.
Right. Even
though it's so worth it for me to get that money back, but doing the work,
right,
it's so out of sight, out of mind.
Correct.
So I have if you guys have any app suggestions that you use for, again, expense tracking and mileage tracking, Intuit, QuickBooks has now had an app that will do the mileage tracking, will do the expense tracking, everything on the go.
Nice.
I know a lot of people that use QuickBooks. My husband owns his own business. He uses QuickBooks a lot.
Yeah.
And I've heard nothing but great things. It's also the thing, like, a lot of these apps, you can get free apps, but whenever you get something for free, understand what information you're sharing.
Right.
So, like,
Right.
sometimes it's worth it to actually buy an app versus using a new app because you just want to make sure, like, you're oftentimes if something's for free, it's because you're selling your information. So when you're using mileage tracking, you're probably selling your data of where you're traveling to advertisers and things like that. So sometimes it's worth just, like, paying for the app.
Sure. Yeah. Looking into it. One thing I will say about this overall theme, I feel like if there's one takeaway from today, I feel like it's you should be tracking everything. If you own a business, you should be tracking everything. Track how often you're traveling, all those sorts of stuff with the tech. We'll get into more data stuff later, and then, like, business sort of stuff, business transition stuff, and all that comes down to how important it is to track data. So
data is king. Data is king for everything. Even things that you're like, this doesn't matter. Data is everything, but tracking it is a nightmare, right? Which is why, again, having the right apps and having the right systems to do that is so important. Your CRM, we don't talk about this a lot. We used to do entire trainings about how to use your CRM, right? Because back whenever we started doing these trainings, a lot of agents didn't have one. It was like, I just, I work with what I have. My CRM is files on the bottom of my car floor.
Correct.
Having a CRM that you could literally pull up on your phone and, like, look up where a client's at, or, like, hey, I'm in this area, I'm in between appointments. Like, if you're still going to your clients' houses, who can I see right now? Who could I door knock on? Who could I talk? And door knock, I don't mean, like, marketing door knocking. I mean, like, who can I visit right now? Or like, I got a phone call from my client. She had this question. She had this situation. I need to make sure I note that. If you don't do it right then and there, you're not going to do it.
Right.
So having the capability to have your CRM on your phone with all your client information and cloud-based, just, again, when you're doing this, data is so valuable that people try to steal it, right? That's like, we're talking data is everything. Yeah, they know that. That's why hackers exist.
Right.
So making sure that you do have really strong safeguards, and that, like, if you do have your CRM on your phone, you have to make sure you have two-way authentication, because if your phone gets stolen or something happens, you need to have a two-way access so that, like, it could be like a passcode and facial recognition or a thumbprint or whatever it is. Just be really cautious of that. Because if you do lose a CRM that's not covered by two-way authentication, the process to, like, you have to alert your clients, you have to alert your carriers.
Yeah.
That process is a nightmare.
A lot of tech nowadays kind of comes with the default where you kind of have to have it, or it at least pops up and gives you the option to opt in or opt out. I would assume with a lot of this sort of data, anything that has to, like, HIPAA stuff, anything any CRM
HIPAA.
That keeps HIPAA stuff, I would assume they probably have the option for that two-way authentication.
I don't have this on here. There is an app that you can download, and it's an authenticator app. It ends up like that's what the screen looks like, but the authenticator is just like a red app.
Is that for LastPass?
Not necessarily, no.
Okay.
Only for LastPass. But there are things that, like, if you do have something that requires two-way authentication, you can tie your apps, or even, like, websites. You can tie your website to that and basically say, like, hey, before you allow someone access into this site, they have to get approved on this authenticator.
Yeah.
And that's something that, again, if you have that, if you ever get audited, it just looks really good to show that you're really trying to protect the information.
Sure.
Integrity for Agents. If you're not familiar with Integrity for Agents, it is the app that Integrity has created that houses the CSG, a CRM, Medicare Center, Medicare app, and Link all on one platform, as well as Lead Center. So it looks like if you just go to your Apple Play Store or Google Play, it's just like it's just Integrity for Agents, and it's just a blue app with the Integrity eye on it. But again, just because it houses so many quoting platforms, it houses Ask Integrity for like AI assistance when it comes to managing your book of business. I don't have time to get into all the things it could do, but for sure, if you're using Medicare Center, get the app on your phone.
Yeah.
Always.
Right.
And the last one that I have on here is just anything for call recording or anything like that in case you are. As we know, when it comes to working with Medicare, if you are doing any type of sales presentation, most calls don't need to be recorded anymore, just if you're doing sales over the phone. But you just don't want to get into a situation where you have a sale, you're right there, you're ready to go, but you don't have a way to record it. And so like you don't want to have to reschedule for something later when they're right there ready to buy.
Right.
So just having that on your phone, most of them will come with it. Yeah. But again, just understanding too storage for that and making sure that you have HIPAA compliant storage. Yeah. Because when you're doing a call recording of a sales appointment, you're talking about HIPAA information.
Yeah. Absolutely.
So
all of this tech is super important. She kind of hit on this, but it's super important. Anytime you do really anything, make sure that you're doing your research, going into it. Obviously, that data, that's honestly a talking point that
in itself.
And that like data. That I feel like we haven't really like hit on before because it's just becoming more and more a thing.
Everything.
In which, yes, because everything is going online, which makes everything more efficient.
Yeah.
But you have to protect it in a different way.
Well, the number one crime right now, is that even a thing? The crimes.
Crimes.
I've
heard of them.
The number one crime currently is like cyber attack. Like the amount of federal revenue being directed towards cybersecurity and like, you're not going to get people who are going to, a company's not being attacked right now by people in masks breaking down doors and stealing things. It's happening from data insecurities and taking advantage of that and stealing. So it is incredibly important, especially now that we aren't seeing paper apps like we used to. Everything's online, everything's digital, everything is email. The fact that companies still accept faxes. Like, for example, like we talk about Cigna and their blunders right now. Companies aren't even able to handle faxes anymore at this point. It's all digital. So just making sure that you're doing everything you can to protect it is key. And Brian says, what's up with my unfiltered camel's voice? I am currently just really sexy, and that is why I have this gravelly tone. I appreciate you asking. I've been working really hard on it.
Also, I think it's so funny that we know Brian well enough to just assume that he's talking about you.
No, we know that I am Brian's favorite always, even though he won't ever admit it. I bet that was very pleasant to the listener. We have new microphones, which makes it really clear, so you get to hear every little crackle. Ugh, the worst is.
Love.
I just grossed myself out. Let's talk about data. Again, we've been everything. This is unintentionally the data episode today. We talk about what should you put in your CRM, what should you be tracking, what do you need to know about your clients, but what are you doing with that information? Mm-hmm. And so this was actually an idea Ben Laves, and who's working with Rachel, had talked about. Rachel has been coaching.
We'll get through it together.
My husband's so lucky to have me his bride, truly. So talking about, Rachel's been giving and teaching agents on how to write more business for the last 13 years. Mm-hmm. So something that we used to talk about all the time and haven't forever is like noticing trends in your client base to try to find strategic alliances, to try to find new people to work with. And how do you start those conversations?
Yeah.
So when you're working with your clients, you're asking them about like, hey, what providers are you using? What pharmacies are you using? Things like that. What they're telling you they're telling you about people who are working with your client base that are not your competitors. And so when you hear from the same person over and over that like, oh yeah, I use Flo's Pharmacy. Then next time you go to Flo's Pharmacy and say, hey, I work with Meryl, Janet, and what's another? Walter. I work with Meryl, Janet, and Walter. They told me they love using your pharmacy. I help them pay for medications at your pharmacy. let's grab coffee sometime and talk about how, how I can help you more, what that looks like. And it's just saying, like, I have 3 people, 3 names that say they use you. We have something in common. Let's get together. Same thing with, like, people who are working or who are, like, retiring from large employers, like the VU here, saying, like, hey, I have insert 3 names of people, all of them retired relatively around the same time from your organization. Hey, can you get me in contact with your HR person? Hey, I wanted to make sure you know, like, I have 3 of your employees that have come to me. I would love to do a presentation for you. I would love to teach your clients. But again, just kind of getting that way, like, it's where to find the next opportunity for a strategic alliance. That stuff that used to be just things I put in an app,
right,
is now like, who's my next partner going to be?
Correct. And also, even on the flip side of that, kind of the opposite of networking, if you're keeping track of the different pharmacies, the different things, the different providers of whatever benefit it may be, and you're noticing a lot of issues, and then you're tracking, you're like, oh, a lot of these same issues are coming from the same pharmacy. They're coming from the same dentist. They're coming from the same. Then you're able to also help your clients say, hey, actually, I've been noticing a lot. People have a lot more success rate or you know what I mean?
Yeah.
Their thing gets filled faster, or it doesn't get declined this way, or all that sorts of stuff. You're able to keep track that way. You're able to help people figure out what's the next step if this certain provider. That was a lot of words, but do you know what I mean?
Well, you're trying to be the local source, right?
Correct.
In a world where even if you are somebody that is a virtual agency, you sell ortho in multiple locations, you tend to have a group of, like, an area where, like, you've kind of found your niche, or if you're wanting to find more people in that area. In a world where we're trying to combat convenience being call centers or internet-based enrollment, right? Where an agent's not even involved. Then you have to find out what your value add is. And oftentimes it is being that local knowledge, that local presence. I understand how this works. I've seen this before. This is not the first time I've come across this situation. And so whenever you build these up and kind of notice these trends, that's a really easy way. You already have the data. You're getting data or data.
I don't think it matters.
It does to me.
I think it's like root and route.
Discussion for another day. I think that matters to me.
Okay.
Anyways, but it is a way for you. You're already getting the information. Do something with it more than just surface level what's going on.
And if convenience is what people want, then offer them. Coming to you might not be the most convenient thing, but once they're there, make it convenient.
Yes. Oh, yeah.
So from there, do you know what I mean?
Yes.
Like, you can add convenience to them after they've already reached out. So it's like, if they like doing things online because everything's quick, you have all the data, all the information.
I want to do my own shopping. Like, I want to see it and then confirm with you. Yeah. Then
do that for them. It takes a bit more work, but it's convenient.
It doesn't take any work. It's because you're just using plan and roll. Using your plan and roll site and just saying, like,
you just have to look into it.
You just have to set it up and just be a little educated on it, right? So totally worth it. It has nothing to do with how you want to sell. It has everything to do with how they want to buy.
Yeah. I also really quick want to go back to this whole like word thing, because Brian said tomato, and I know that that's the saying, but nobody says tomato. Why do we use that as the example?
Tomato, potato, but not data.
Yeah, it's like people are like, oh, tomato, which I say that, but that's not even a good example because no one says tomato.
Who says tomato?
No one says tomato.
Is that like a British? Is that like aluminium? How British say aluminium versus aluminum?
Schedule.
What?
Tuesday, in it.
What?
Schedule. They say schedule.
Schedule
instead of schedule.
Who are these people?
The British.
And I know Canada, instead of saying progress.
Yeah.
It's like progress. We digress.
Out. I know that they say that. That was an intrusive thought. I should have kept that in my head.
I can't click anymore.
Oh, no. Are you sure? Press a different number. Oh, goodness.
Goodness me. Okay, tell me. Okay, well, Grady, please do the whole show in that voice. Okay, you now have to do the rest of the show.
I'll do it. What are we going to next?
This one. The next one. Let's talk about this for a little bit. not my British accent, with Sadie in a British accent. Am I overpaying for this book of business? I have seen this question, undoubtedly have seen this question on all the platforms and all the social media stuff, on all the forums, about people looking to buy or people looking to sell their book of business. Yeah, okay. The thing to keep in mind is, and I've seen that a ton, keep in mind, so the industry average, what people have come to see with the industry average and like come to expect is anywhere between 1.5 to 3 times the renewals that person is going to receive, and say that's how much my business is worth. Things have gotten so incredibly complicated. We work with Access Capital, who what they do is they because most like lawyers and things like that, they don't understand how renewals work. They don't understand how like different types of businesses, how they stick on the books and things like that. So like that is a good base to work off of, 1.5 to 3 times the value of renewals. But is the book of business a Medicare Advantage one? Because that's actually worth a lot less than a Medicare supplement book of business because of the stickiness of that.
Right,
so if most of it's Medicare Advantage plan, you're wanting to buy it, one, because the growth of like the uncertainty around Medicare Advantage and the lessening amount of loyalties to the carrier. If they're less loyal to the carrier, they're going to be less loyal to that agent who they don't know. When most organizations, including Access Capital, when they go and look at how do I value this business, they use what I don't know if this is the actual term, is what our office terms it as, is the melting ice cube, which means based on a percentage of the switching rate of this type of business, whether it's MedSup or Medicare Advantage plans, we expect if you buy this book of 100 clients, we know eventually if you don't touch that book of business, if you do nothing with it, that book of business is going to end up going to 0 clients, either because that clients, they are not loyal or they pass away.
Right.
So they'll say within 10 years. So they call it the melting ice cube. Here's what this book of business is going to bring in based on the revenue or based on the renewals over the next 10 years, is eventually that number is going to be 0. Mm-hmm. That's the melting ice cube concept. That's what the 1.5 to 3 times the annual, that's what that's based off of, and why they came up with those calculations. However, what we've seen whenever, senior marketing specialists, we have a division of our company called Access Acquisition Pathways. And we've noticed that whenever this group of people buys a book of business, the melting ice cube concept doesn't work. Mm-hmm. It actually grows in value because they're cross-selling additional products. They're putting them on Medicare supplements that start paying a premium again, because most Medicare supplements will stop, commissions. Most med subs will stop paying commissions at 6 to 7 years, but they're still in the books. They're not bringing any income,
right? But
they're still considered as the data that you're buying. Correct. So ultimately, what I'm saying is, let her do the voice.
Let her do the voice.
Let her do the voice. Give it the roar.
Do the roar.
Do the roar. So ultimately what that means is that these are some questions you need to be asking if you are going to buy a book of business and someone just started doing something outside.
I feel like they shouldn't, because our new mics are so good.
Oh, how exciting.
In theory, they shouldn't be able to hear it.
Let me know if you hear a rumbling in the background. So, questions you need to be asking if you're buying or selling your book of business. Number 1, how many products per client are there? If it's just 1 or 2 products per client, that it's going to be less sticky. You could expect more of that melting ice cube where less people are going to stick on the books. Number 2, do they even have access to sell you that book of business? Every carrier will do something different. Some carriers will require you to be an LLC or an S Corp. They will not allow you to sell your book of business if you are an individual to an individual. So that's a big question to ask. Number 2, when you're trying to buy or sell, if you are an individual and you're not a corporation, you need to ask yourself, like, are you just trying to sell the commissions? Mm-hmm. Are you wanting to sell the ability to service that book of business? Because those are 2 different things. Yeah. You might be able to sell the commissions, but you can't sell the servicing statuses. And that affects come next day EP when it comes to doing certifications. If that agent doesn't do their certs, you stop getting those commissions. Right. So there's a lot of questions you need to ask yourself if you're going to buy or sell a book of business, because majority, like, I only know of 2 places that can value an insurance book of business correctly, Access Capital being one of them. Yeah. And so there's just so many questions to ask. And then asking yourself, like, what are your expectations with this business if you buy it? Are you okay with the melting ice cube? There are companies that build their entire careers off of buying a book of business that knows won't exist in 10 years. They're not going to touch it. They're not going to do it. It's just a revenue source.
Yeah.
What can you do? There's so many things you can do when you buy a book of business to introduce yourself and save as many clients in the book, especially during these tumultuous. I keep wanting to use that word and I haven't.
Tumultuous?
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 Tumultuous. I'm hungry.
Tumultuous.
I've yet to figure out that word and I've used it all the time. It's kind of like facetious.
To mulch. You have to
to
add
mulch.
mulch.
To mulch. I wanted to say
Tumultuous.
munch.
Tumultuous. There's an L in there.
Tumultuous.
Like mulch. Like on the
I
ground.
don't really know. I use the word facetious a lot, and I don't think I know what it means.
Facetious?
Facetious. I say like silly. Like
Yeah,
you're being
yeah,
dramatically silly.
Yeah, like facetious.
You're being so facetious right now.
Yeah.
Ask the right
Tomato,
questions.
tomato.
Tomato. So ask the right questions if you are interested in buying or selling a book of business. It is not just like, okay, take 2x times your information or 2x times your renewals. That's what it's worth. That's not true. And if you're buying a book of business and they're trying to sell it to you that way, call us first. There are so many things that people don't understand, so many questions people don't understand to ask when buying and selling.
Right.
Make sure you talk to us first because, again, I talked about this a couple years ago at an event I was speaking at, but I worked with an agency that she actually went bankrupt because she bought a book of business. It was in Kirksville, Missouri. She bought a book of business.
remember this.
She called me afterwards. It was very early in my career. I started in 2013. This might have been like in 14 or 15.
Never mind. I don't remember this. I was
She-
still in high school.
Don't do that. Don't do that to me. Let's not play that game. And she said, I bought this book of business. It was actually with Mutual of Omaha. She bought this agency that had been doing it in Kirksville for years and years and years. I bought Mutual of Omaha business from her. She was the #1 Mutual of Omaha producer in Missouri. Tell me how I can get in front of them. And we looked at it. She didn't buy a damn thing. Couldn't get the commissions transferred over because she was an individual. But all the lawyers looked it over and all the
Right.
contracts were signed. So she bought something she could do nothing with and could not recover from that.
It's terrible.
It's so important to ask the right questions. And your lawyers, a carrier doesn't care about a bill of sale. In a lot of cases, you need to make sure that you understand how your carriers view your relationship and view how somebody can come in and take over that relationship.
Yeah.
That's my heathen of warning. I would
I
tell
don't know
you.
if this is gonna work. I'm so sorry. I don't
I'm
know what's going on.
sweating. Unrelated.
It's the heater.
It's the heater. Guys, that is the Medicare Cafe today. What we're trying to do is break this up into segments so that you can take and choose types of things that you want to listen to. Brian, thank you for your colorful commentary as always. Again, if you are watching the recording version of this and you just I have some questions, clarification, I want to tell you that I say the word tomato, text me. You can also call me. Call me, beat me if you want to reach me. And again, more than happy to answer your questions. But that's all I got. Tumultuous. I'm never gonna get
Tumultuous.
that right.
You will. I
Tumultuous.
believe in you. You'll get it.
There's a couple words I will never say correctly. Tumultuous, which I'm very proud of myself. And my default when I say always, I always I go like
Always?
always.
I feel like that's given Midwest.
Midwest
Always.
always. I'm like, oh.
Always, yeah.
Cheerio.
What was the word? One time I was like, I have arthritis, but I kept saying arthritis. And you stopped me and you were like, because I was talking about it a lot. I have arthritis, if you guys don't know.
Sadie has arthritis.
Yeah, I don't have my phone number up here, but I would appreciate some texts and emails because it's really
Thoughts and
hard
prayers.
about a month out of the whole year. Okay, so yeah, you were like, I have to stop you. Arthritis. You're saying arthritis, and I was like, arthritis. I don't know. I still don't know if I'm saying it right.
I think that it was a lot of gumption, a lot of nerve
Arthritis.
for me to say that because I can't speak. So for me to call you out on something, wow, who do I think I am?
How do you say both? If you say both,
Oh. Both?
both.
Both. I don't even like the look of my face when I say both.
I don't like that.
Both. Both. I don't say both. Both. I don't say both. I say both. Today, friendships were ruined. So I can't end.
I
the
know, I
presentation.
will. I'm so sorry. As someone who works behind the scenes, I just want to say thank you for you guys being so patient because truly, this will be so much better. Hopefully it honestly is. Hopefully, honestly, the audio is so much better than what it used to be.
Way better.
We just have some learning curves,
Both.
but we'll get there. So
So until next time, I'll do a fun and dance. Well, you can stay on. They have to hear you.
No, you're right.
So until next time, have fun
Make money
and give impeccable service. Thanks, guys. Here's my song and dance.
Run.
Michelle, my seniors are call arthritis Arthur, and he isn't kind. Oh, love you.